Good morning all. Today we will learn about transamination process. By definition, it's a transfer of amino group. So you can see it's a transfer of amino group from one amino acid to a keto acid to form a new keto acid and new amino acid. So you can see, so once amino acid, the amino group from this amino acid is transferred onto this keto acid, there is a formation of new amino acid and a new keto acid. So this reaction is catalyzed by a PLP dependent transaminases. So it's a general terminology used for transamination reaction, the enzymes transaminases. There are many, but specifically important transaminases we have are two, AST and ALT. So ALT, that is alanine transaminase, this enzyme catalyzes the conversion of alanine to pyruvate with the acceptor is alpha ketoglutarate, which forms a new amino acid, that is glutamate. So PLP is an integral part of this transaminases. One more transaminase we have is aspartate transaminase. So it helps in transamination of aspartate. So the amino group from aspartate is removed and the acceptor here also is alpha ketoglutarate. So after donating amino group, aspartate becomes oxaloacetate, and after accepting amino group, alpha ketoglutarate becomes glutamate. So in majority of the transamination reaction, alpha ketoglutarate is the amino group acceptor. So during this process, we will see what is the role of this PLP, that is vitamin B6. So this pyridoxal phosphate, it acts as a carrier for amino group. So if you see, it is the integral part of the structure of transaminases where it is attached covalently. That's why it is called as a prosthetic group. So the process of transfer of amino group is through ping pong mechanism. So we will understand this little bit clearly. So once the amino acid donates its amino group, it is received by this PLP and it gets converted itself into a pyridoxamine phosphate. So the PLP, pyridoxal phosphate, becomes pyridoxamine phosphate. So after removing amino group, this amino acid becomes a new keto acid. Now the amino group from this pyridoxamine phosphate is received or accepted by a keto acid, that is alpha ketoglutarate, and it forms a new amino acid. So this is how exactly the amino group from an amino acid is transferred onto a keto acid. Salient features of transamination reaction. The reaction is reversible. In this reaction, amino group is transferred. So transaminases belong to class 2 of enzyme classification. The acceptor generally is alpha ketoglutarate, which will form glutamic acid, and we also should observe that there is no free ammonia liberated here. It's only the transfer of amino group happens, and this reaction requires a coenzyme, that is pyridoxal phosphate. AST and ALT are the major contributors of this transamination reaction. Now we will see the biological significance of transamination process. It is involved in both synthesis and degradation of amino acids. First step of amino acid catabolism. All the amino group removed are concentrated in glutamate, and glutamate is the only amino acid which can liberate free ammonia. This process also helps in synthesis of non-essential amino acid. Non-essential means there is a synthesis of these amino acids in the body. That's why no need to take through diet. So when we are synthesizing, how is this synthesized? It is through transamination reactions. It also helps in interconversion of amino acids. We should remember that threonine, lysine and proline, they do not take part in transamination reaction. Important diagnostic enzymes we have are AST and ALT. So both of these transaminases are very important in liver diseases. So we will see a little more about these AST and ALT. ALT, alanine transaminase, an enzyme which catalyzes the transfer of amino group from alanine to alpha ketoglutarate to form a new keto acid, that is pyruvate, and a new amino acid, that is glutamate. So this enzyme is cytosolic enzyme. Serum levels ranges from 5 to 40 international units per liter. This enzyme is elevated in alcoholic liver disease, cancer of liver, hepatitis or inflammation of liver, non-cancerous conditions of liver, and some drugs or some medicines which are hepatotoxic also will increase this ALT. Cirrhosis or scarring of liver, necrosis of liver tissue. So majority of the liver damage will release this ALT. Coming to one more important transaminase, that is aspartate transaminase. It's found in both cytosol and mitochondria. Less specific for liver when compared to ALT. This is also elevated within heart, muscle and brain disorders also. The serum level ranges from 10 to 45 units per liter. Again, some laboratories will also give gender different transaminase levels also. This aspartate transaminase enzyme catalyzes the conversion of aspartate to oxaloacetate, where a new amino acid, that is glutamate, is formed once alpha ketoglutarate receives the amino group. AST elevation may indicate cirrhosis of liver, hepatitis, in cardiac diseases like heart attack or other muscle diseases also it is elevated. Acute hemolytic anemias also will increase the AST. That's why care should be taken whenever hemolyzed blood is sent to lab for analysis of AST. Acute pancreatitis, acute renal failure and recent surgeries have shown that there is elevated AST levels in these conditions also. Instead of measuring these two as a separate entity, it is important to go with the ratio of AST to ALT. The normal ratio of AST to ALT is 0.8. The clinical significance of AST to ALT ratio, or otherwise called as de-Ritis ratio. If the ratio is more than 2, it indicates alcoholic hepatitis, hepatitis with cirrhosis, non-alcoholic steatohepatitis, liver metastasis, myocardial infarction, and some of the drugs like erythromycin treatment. Low ratio, or in other words, if we have ALT very high, very major indicator of acute hepatocellular injury, a toxic exposure, and also obstruction, that is cholestasis. Thank you.